Alarmingly, as many as 1 in 10 people in the US have diabetes, according to the CDC. Of these, overwhelmingly 90% have one type in particular, type 2 diabetes. What's even more worrying is that almost 4 in 10 people living in the US have prediabetes, a condition where blood sugar, aka blood glucose levels, aren't high enough to be considered type 2 diabetes, but high enough to worsen the risk for it later down the line substantially. But what exactly is type 2 diabetes? Why is it harmful? And given that being overweight is considered one of the key drivers in the ever-emerging type 2 diabetes rates, how effective is weight loss, on the other hand, in helping the condition? Well, today we'll be discussing all this and more. But first, as always, please take note of our disclaimer. To talk about diabetes, we need to discuss the most important role of insulin within our bodies, which is that it acts as a sort of key for blood sugar to enter our cells to be used as energy for various bodily processes. We get blood sugar primarily from the carbohydrates we consume sitting by sitting, but also from dietary fats and proteins too. When cells have high insulin sensitivity, the body cells are very good at responding to insulin, which is good since the cells can intake blood sugar, get energized and support health. Yet when cells have high insulin resistance, they don't respond well to insulin, so they are less able to uptake glucose from our bloodstream for energy, resulting in them starving and dying. So with that being said, diabetes is a condition where the body doesn't make enough insulin, is unable to use the insulin that it does make, or a mixture of both. Two main types of the condition are type 1 and type 2 diabetes. In type 1, the immune system attacks the insulin-producing cells, known as the beta cells, in your pancreas, which results in little or no insulin being produced. This type is largely genetically related. Whereas in type 2, the main topic of this video, there are two main interconnected issues at play. Number 1, the amount of blood sugar available exceeds the amount of insulin that the pancreas can make, resulting in a significant proportion of the blood sugar not being able to be uptaken by the cells to be used for energy, and hence laying around in the blood vessels instead. And number 2, insulin resistance, which again is when the cells don't respond adequately to insulin, further exacerbating the overflow of sugar in our blood vessels. Type 2 diabetes is thought to have a genetic component too, but is mostly lifestyle related. That's why this form of diabetes is so apparent in people overweight, as poor diet and physical inactivity are major causes for both. On a side note, if you're interested in undertaking our evidence-based and results-backed personalised Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in our description. There's a range of severe health problems that type 2 diabetes increases the risk for, like heart disease, kidney disease and stroke for example. However, two conditions you should be aware of but are lesser spoken about are diabetic retinopathy and diabetic foot ulcers. Diabetic retinopathy is the most serious eye disease linked to type 2 diabetes and the most common microvascular complication. It happens when the blood vessels in the eye's retina are harmed by excessive blood sugar floating about. The reason why it is such a concern is that it can lead to vision impairments and even blindness. What's even worse is that detection of it is often delayed until only after severe damage has already occurred, whereby treatments are less able to help the condition. And this potential complication of type 2 diabetes isn't rare either. Sadly, it's thought to affect as many as 1 in 4 type 2 diabetics worldwide. Additionally, it has been suggested to be the leading cause of blindness in the adult working population. Next, diabetic foot ulcers are said to affect up to 15% of diabetics at some point in their lifetime. There are many reasons they can occur in people with diabetes, but mainly because excessive blood sugar levels damage the sensory nerves in the area and blood vessels. Diabetic foot ulcers are unsettling because as many as 1 in 5 individuals with them go on to need amputation consequently. In fact, it has been suggested that every 30 seconds globally, a limb is sadly lost due to diabetes. This is concerning not only due to the impact this has on these individuals' overall quality of life, but also because the odds of premature death rise substantially after the operation. It's been suggested after 1 year of lower limb amputation in diabetics, the death rate is between 10 and 50%, and after 5 years, between 30 and 80%. Fortunately, type 2 diabetes is now thankfully recognised as a potentially reversible condition with the possibility of long-term remission. A range of interventions are available to help the condition, such as drugs, insulin therapy, exercise and certain diets. But today we'll be looking at the literature pertaining specifically to weight loss. For example, type 2 diabetes of less than 6 years duration is usually able to be returned to normal with 15% weight loss, and reversal can still occur in some people with even up to 24 years duration. And even a modest amount of weight loss has been demonstrated to help the condition. An analysis from the Look Ahead study, consisting of more than 5,000 individuals with type 2 diabetes, found that even just 2% of weight loss was associated with an improvement in blood sugar levels. But of course, greater weight loss results in greater benefits. And weight loss is not just a treatment for type 2 diabetes either, but also one of the main ways to prevent its onset too. Take the Diabetes Prevention Programme Research Group study for instance. In it, weight loss of 6.7% body weight reduced the occurrence of diabetes by more than half. Nevertheless, despite its efficacy, it's noteworthy that weight loss is not the end-all and be-all when it comes to successful weight management and its associated health outcomes. Weight maintenance is equally important, but unfortunately the research indicates that this is still a long-term uphill struggle for many. One study found that of 55 obese women who lost 21.1 kilos, or 46.5 pounds on average after a 6 months weight loss program, 3 in 4 of them regained more than their baseline weight at 5-year follow-up. Luckily, there's a variety of tips available at their disposal to drastically improve the likeliness of weight maintenance. If you'd like to check these out, as well as several causes for the weight regain, please check out the video in the top right-hand corner of the screen. Furthermore, one major problem with type 2 diabetes is that approximately half of the people with the condition are unaware they even have it. So it's definitely worth looking into getting your blood sugar levels assessed by your doctor next time you get an opportunity. At the same time, your doctor may also advise if you should undertake any medical strategies on top of lifestyle ones to help irregular blood sugar levels and improve the likelihood of keeping the weight off long term. But again, that's for them to decide. Have you been able to successfully help your blood sugar levels through weight management? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for listening, and I'll see you next time.